Hi everyone, hopefully everyone is doing good. In my last video I had completed the clavicle. Hopefully everyone understood what is a clavicle and its muscle attachments, presenting parts and its anatomical position. Today I will be starting with scapula. I will be discussing about scapula, and it's a bit confusing initially, but I'll try to make it easy for you, okay, as much as possible, right? Lakho, scapula. Scapula, what is it actually? It's a flat triangular bone, okay? You have to say that it's a flat triangular bone. ধাপে ধাপে আমরা এগোবো, ঠিক আছে, in steps. So first talking about its anatomical position and its presenting parts. See, for the anatomical position, this concave part with oblique ridges, these should be in front, okay, in front, and এখানে যেটাতে spine আছে attached, this surface should be behind, right? And this cavity, it's called the glenoid cavity, this should be directed laterally, right? Laterally forwards. তো আমি যদি এটা এখন anatomical position ধরি, how will it be like? You have to hold it in gun holding position, okay, in gun holding position, like this. See, the costal surface will be directed forwards and medially, the dorsal surface will be directed backwards and laterally, glenoid cavity will be directed laterally, right? And this is the anatomical position. You have to hold it in left hand since it's the left scapula, right? This is the anatomical position. Now talking about its presenting parts, right? Talking about its presenting parts, what can you see here? This is a surface, this is a surface, these are spines, yeah, spinous processes and borders, okay? So there are two surfaces, three borders, three angles and three processes. Ki bole dicchi. First of all, this is a costal surface, the front one, okay, the front one, this is a costal surface, and yes, the bone is translucent. The bone, in some bones there will be translucence, right? If you hold it in sunlight, তখন এটাও বলতে হবে কি এটা ট্রান্সলুসেন্ট, রাইট? ডোন্ট মিস দ্য পয়েন্ট। সো এই যেটা ফ্রন্টে আছে, দিস ইজ আ কস্টাল সারফেস, যেটা পেছনে আছে দিস ইজ আ ডরসাল সারফেস। বর্ডার্স, hold it in anatomical position, you are seeing this is the border, this is a medial border, ঠিক আছে? This laterally, so it's the lateral border, ঠিক আছে? And this is on the superior part, on the superior edge, so this is the superior border, ঠিক আছে? So three borders হয়ে গেল। এবার অ্যাঙ্গেলের কথা বলি। Hold it in anatomical position again. See, this is the superior angle, ঠিক আছে? এটাকে আমরা কিন্তু মিডিয়াল অ্যাঙ্গেল বলছি না, এটা কিন্তু সুপিরিয়র অ্যাঙ্গেল, ঠিক আছে? নামটাই এরকম। এটা হচ্ছে ইনফিরিয়র অ্যাঙ্গেল, ওকে, যেখানে হচ্ছে জাংশন অফ মিডিয়াল অ্যান্ড ল্যাটারাল বর্ডার্স। সুপিরিয়র অ্যাঙ্গেলে কার জাংশন হচ্ছে? সুপিরিয়র বর্ডার অ্যান্ড মিডিয়াল বর্ডার। অ্যান্ড এই যে ল্যাটারাল অ্যাঙ্গেল আছে, এখানেই তোমার গ্লেনয়েড ক্যাভিটিটা আছে, এখানেই তোদের গ্লেনয়েড ক্যাভিটিটা আছে। অ্যান্ড এটা কার জাংশন? দ্য ল্যাটারাল বর্ডার অ্যান্ড দ্য superior border. There's a lateral angle and is the junction between the lateral border and the superior border, ঠিক আছে? তিনটে border, তিনটে angle, দুটো surface হয়ে গেল। Now coming to your spinous processes, okay? দেখ, এবার দেখ এই জিনিসটা এত অবধি, ওকে, এটাকে বলা হয় স্পাইন অফ স্ক্যাপুলা, ঠিক আছে? এটা একটা অ্যাঙ্গেল, ঠিক আছে? এই অ্যাঙ্গেলটার নাম হচ্ছে অ্যাক্রোমিয়াল অ্যাঙ্গেল। দিস অ্যাঙ্গেল ইজ অ্যাক্রোমিয়াল অ্যাঙ্গেল, অ্যান্ড দিস প্রসেস, দিস প্রোট্রুডিং প্রসেস, দিস ইজ দ্য অ্যাক্রোমিয়াল প্রসেস, ঠিক আছে? This is the acromial process. And this one একটা বেন্ট ফিঙ্গারের মতন আছে, ঠিক আছে, একটা বেন্ট ফিঙ্গারের মতন আছে just above the glenoid cavity, just above the glenoid cavity, right? This is the coracoid process. So three processes are there: the spine of the scapula, the acromial process, and the coracoid process, right? So three spinous processes, two surfaces, three borders, and three angles. Presenting parts শেষ। আচ্ছা, আর কয়েকটা ছোট ছোট জায়গায় প্রেজেন্টিং পার্টস কি কি আছে বলে দিচ্ছি। এই যে একটা নচ, দিস নচ ইজ কল্ড দ্য suprascapular notch. The suprascapular notch. We'll come to this later. এই যে এটা আরেকটা নচ, you are seeing this one, this one, this one, yes. This is the spinoglenoid notch. This is spinoglenoid notch. Here there is a tubercle just below the glenoid cavity. This is the infraglenoid tubercle. Okay, feel korle bujhte parbe it's a little rough. Okay, and here there is another tubercle. It is infraglenoid tubercle. There is another tubercle here which is called the supraglenoid tubercle. Why? Because it is above the glenoid cavity. ঠিক আছে, it's above the glenoid cavity. And এটা glenoid cavity বোঝা যাচ্ছে। Up to this, no confusion, right? Okay, now coming to your muscle attachments. In your muscle attachments, six major muscles need to be specified, right? 6 major muscles need to be specified. কি একটা হচ্ছে subscapularis, একটা হচ্ছে supraspinatus, then comes infraspinatus, then comes teres major, teres minor, okay, serratus anterior, yes, serratus anterior. 6 major muscles need to be specified. So either attachments kothay kothay. Okay, now see, this is the costal surface, right? Hold it in anatomical position. This is the costal surface. Now there is a muscle called the subscapularis which gets attached on this region. ঠিক আছে, on this region, on this entire region, just leaving this portion, just leaving the medial border, right, like this. This for the attachment of subscapularis muscle on the costal surface. Medial border ki attach hocche tale? What is getting attached on the medial border? The serratus anterior muscles. Okay, the serratus anterior muscles by 8 digitations. Okay, the first digitation will get attached on this region. The second and third digitations will get attached on the medial border, while the rest of the 5 digitations will get attached on near the inferior angle. ठीक है, will get attached near the inferior angle. Now you can see oblique ridges here, right? You can see oblique ridges here. These ridges give attachment to the intermuscular intersections of the subscapularis. Vaivate dhore. In Vaiva you will be asked this oblique ridge. What is this oblique ridge? And what does it, what does these oblique ridge give attachment to? Which muscle? তখন বলতে হবে it gives attachment to the intermuscular intersections of the subscapularis muscle, right? So subscapularis halo serratus anterior on the medial border, okay, in the costal surface only, yeah, not on the dorsal surface. Now coming to the dorsal surface. Dorsal surface is divided into the supraspinatus fossa and the infraspinatus fossa by the spine of the scapula. So supraspinatus fossa te attach hoy, as the name suggests, supraspinatus muscle, and on the infraspinatus fossa is attached the infraspinatus muscle, right? Now lateral border on the costal surface, this area is covered by the subscapularis. Coming to the dorsal surface, okay, lateral border on the dorsal surface, okay, lateral border on the dorsal surface. Ki attached hai? 3 muscles are attached, okay, from above downwards, okay. Here is attached teres minor muscle, here is attached teres minor muscle, এখানে attach হচ্ছে teres major muscle, and at the inferior angle is attached the latissimus dorsi muscle. Latissimus dorsi টা আমি important muscles এ ধরিনি, okay, it's a small muscle attachment, okay, and small muscle বলতে it's a large muscle but it has a small attachment on the scapula. So এখানে latissimus dorsi, teres major and teres minor, right? One thing about teres minor, the attachment, there is a মানে এখানে attach হচ্ছে, right, but you will feel here there is a groove, okay. This groove gives passage to a artery called the circumflex scapular artery, okay, which discontinues the attachment of teres minor muscle, ঠিক আছে, it intervenes in between the attachment of teres minor muscle. কি হয় হচ্ছে, the circumflex scapular artery will pass around the lateral border and will enter the infraspinatus fossa, ঠিক আছে, will enter the infraspinatus fossa. So lateral border এখানে হয়ে যাবে, খুব ভালো কথা. So coming to your dorsal surface and medial border. On the costal surface আমাদের কি attachment ছিল? On the medial border serratus anterior. On the dorsal surface in the medial border there are attachments, ঠিক আছে, কি attachments? First of all, in this area, ঠিক আছে, যেটা হচ্ছে তোর superior angle, ঠিক আছে, dorsal surface এর পেছনে যায় superior angle, এখানে attach হচ্ছে levator scapulae muscle, ঠিক আছে। তারপরে in this region এই যে ট্রায়াঙ্গেল এর মতন এখানে levator scapulae হলো, ঠিক আছে, এখানে levator scapulae হলো। এবার এখানে একটা ট্রায়াঙ্গুলার ইমপ্রেশনের মতন আছে, ঠিক আছে, যেটা কি স্পাইনকে অ্যাটাচমেন্ট দিচ্ছে, এটাকে বলা হয় অ্যাপেক্স অফ দ্য স্পাইন, ঠিক আছে। অপোজিট দ্য অ্যাপেক্স অফ দ্য স্পাইন in this region will be attached rhomboidus minor muscle, ঠিক আছে, and তার জাস্ট নিচে, just below the apex will be attached the rhomboidus major muscles. So কি কি attachment হলো? Above the apex of the spine levator scapulae muscle, opposite the apex of the spine rhomboidus minor muscle, below the apex of the spine rhomboidus major muscle get attached, right? সো এই বর্ডারগুলো হলো এবার সুপিরিয়র বর্ডারে তেমন অ্যাটাচমেন্ট নেই, জাস্ট কি সুপিরিয়র বর্ডার ইজ continuing with the suprascapular notch, right? Now medially in this region, okay, in this part, medial end of the suprascapular notch gets attached the inferior belly of omohyoid, ঠিক আছে, inferior belly of omohyoid, right? So এটা হচ্ছে মেজর মাসল অ্যাটাচমেন্টস হলো, আরও আছে অন দ্য স্পাইন, ওটা আমি পরে আসছি। বাট তার আগে যেটা দরকার হচ্ছে দ্য ভেসেলস অ্যান্ড নার্ভস উইচ আর রিলেটেড টু দ্য স্ক্যাপুলা। কিপ দিস ইন মাইন্ড অ্যাজ আ রুল। The medial border is related to the descending branch of cervical transverse artery, ঠিক আছে, or descending branch na actually descending transverse cervical artery, okay, this is the name, descending transverse cervical artery and dorsal scapular nerve, ঠিক আছে, dorsal scapular nerve and transverse cervical artery descending, ঠিক আছে। lateral border, yeah, lateral border, which artery is present? You know that on the lateral border in the dorsal surface teres minor is getting intervened, okay, intervened by the circumflex scapular artery, okay. So lateral border is associated, is related to the circumflex scapular artery. And on the superior border, okay, on the superior border is related, the superior border is related to the suprascapular nerve and vessels, right? suprascapular ব্যাপারে এবার আমি বলছি, আর suprascapular নচের ব্যাপারে বলছি, and spinoglenoid notch, spinoglenoid notch gives a continuation from the supraspinatus to the infraspinatus, ঠিক আছে, the spinoglenoid notch. The suprascapular notch, it is U-shaped, roughly U-shaped. This is bridged by a ligament like this, okay, this is bridged by a ligament called transverse scapular ligament, right, and converts the suprascapular notch into a foramen called the suprascapular foramen. Now this foramen gives passage to the suprascapular nerve like this, and the suprascapular nerve, আচ্ছা নার্ভের ওটা বলার আগে suprascapular nerve কে এটা প্যাসেজ দিচ্ছে, but the suprascapular vessels, okay, they are passing above the transverse scapular ligament, right, they are passing above the transverse scapular ligament. Now these two structures, the suprascapular vessels and suprascapular nerve, after they cross the suprascapular notch, they pass through the spinoglenoid notch, right, like this, এখান থেকে ঢুকে এখান থেকে বেরোবে, ঠিক আছে, এইভাবে, রাইট, বোঝা গেছে, হোপফুলি বোঝা গেছে। আচ্ছা, সো কি কি রিলেশন বললাম? সুপিরিয়র বর্ডারে সুপ্রাস্ক্যাপুলার আর্টারির কথা বলছি, নার্ভগুলো আছে, আর্টারি এবার আমি কথা বলছি। সুপিরিয়র বর্ডারে সুপ্রাস্ক্যাপুলার আর্টারি রিলেটেড আছে, মিডিয়াল বর্ডারে ট্রান্সভার্স সার্ভাইকাল আর্টারি রিলেটেড আছে, অ্যান্ড ল্যাটারাল বর্ডারে সার্কামফ্লেক্স স্ক্যাপুলার আর্টারি রিলেটেড আছে। These arteries form collateral anastomosis on the costal surface and the dorsal surface of the scapula, ঠিক আছে, clinical importance আছে, we'll come to that later, you will come across these, these anastomoses you will come across. ঠিক আছে, এই অ্যানাস্টোমোসিসটা আছে তোর in your axilla part, right? It is present in your axilla part. Okay, now coming to your, so everything you understood, okay? Hopefully you have understood till now. Now coming to some complications, some complicated parts, but it's adventurous. So the spinous processes, okay? The spinous processes, three processes bollam ki ki? Let's say spine, scapular spine, acromial process, and it হচ্ছে coracoid process, right? And it হচ্ছে glenoid cavity. First glenoid cavity কথা বলে দিচ্ছি, okay? It's present on the lateral angle. Glenoid cavity নিচে আমি একটা বলেছিলাম infraglenoid tubercle আছে and supraglenoid tubercle আছে. Infraglenoid tubercle attach হবে হচ্ছে the long head of triceps brachii, and on the supraglenoid tubercle will be attached the long head of biceps brachii, right? এই দুটো মাসেল আছে, very important muscles. They have a huge amount of attachment on the ulnar, radius and humerus. এখানে small attachment আছে, okay? Now the glenoid cavity is shallow. You can see it's shallow. It gives attachment to the head of humerus like this, okay, to form the ball and socket joint, which is the shoulder joint. The glenoid cavity is deepened by a ligament called the glenoid labrum, which is attached to the periphery of the glenoid cavity. You can feel it, it's smooth, okay? আমারটা smooth দেখা যাচ্ছে, I don't know about your bones. Hopefully it will you will feel the smoothness. Now the periphery of the glenoid labrum gives attachment to another ligament called the capsular ligament, which also includes the supraglenoid tubercle, right? This is very important because then you can understand that within the shoulder joint, within the capsule, within the cavity of the shoulder joint lies the biceps brachii. ঠিক আছে, the long head of the biceps brachii. This is all about the glenoid cavity. Now coming to the coracoid process, simple থেকে আসি. Yeah, coracoid process, it is like a bent finger. At its base, as I said, is attached the transverse scapular ligament. Transverse scapular ligament, আমার পেনের যে মাথাটা আছে, the head of my pen is representing the transverse scapular ligament. Now coming to the coracoid process at tipe attach হচ্ছে the short head of biceps brachii and the coracobrachialis muscle, right? The coracobrachialis muscle and the short head of biceps brachii. Now on its posterolateral aspect, here on its posterolateral aspect are attached two ligaments. ঠিক আছে, কি কি ligament? The coracoacromial ligament and the coracohumeral ligaments, okay? These give support to the shoulder joint. ঠিক আছে, these give stability to the shoulder joint. This is all about the coracoid process. Now coming to the spine of the scapula. Now the spine of the scapula has an apex. This is the apex, this is the base, and this is the crest. This is the base, this is the apex, and this is the crest, okay? Till this triangular region ta eta hocche crest. And then you can see there is a angle. This is the acromial angle. ঠিক আছে, this is the acromial angle. And then comes your acromial process. Okay, here comes the acromial process. Now the spine of the scapula, apex halo, base halo and crest halo, right? It has a upper surface, lower surface, which both give attachment to supraspinatus and infraspinatus respectively. এবার এখানে একটা মার্জিন দেখতে পাচ্ছিস, this margin, this are upper and lower lips respectively, okay? or medial lip বলতে পারিস, হ্যাঁ এটা হচ্ছে medial lip and this is the lateral lip. এবার on the medial lip is attached throughout the medial lip, which continues till the acromial process, it attached the trapezius muscle, while on the lateral lip is attached the deltoid muscle, okay, till the acromial process. ঠিক আছে? So medial lip or upper lip e attach হচ্ছে trapezius muscle and lower lip or lateral lip e lateral lip e attach হচ্ছে deltoid muscle. ঠিক আছে? Now coming to the acromial process. তার আগে আরেকটা জিনিস বলে দিচ্ছি, superior angle একটা জিনিস বলা হয়নি, superior angle since the trapezius muscle is attached on the medial border, trapeziusটা এইভাবে আসছে, ঠিক আছে? So the superior angle is beneath the trapezius muscle and is related to the accessory spinal accessory nerve, right? Coming to the acromial process, ঠিক আছে? acromial process এখানেও the thing is acromial process একটা medial margin আছে and একটা lateral margin আছে, ঠিক আছে? The lateral margin gives attachment to the deltoid muscle, the medial margin gives attachment to the trapezius muscle. But on the tip of the acromial process, on the tip of the acromial process gets attached the coracoacromial ligament. As I said, এখানেও তো posterolateral aspect on the posterolateral aspect is attached your coracoacromial ligament, okay? The coracoacromial ligament, it gets attached like this, yes, it gets attached like this. It is hood like, okay, and it gives stability to the shoulder joint. This is about the coracoacromial ligament. Now the clavicle, okay, জিনিসটা হচ্ছে কি, on the medial border, okay, on the medial border in the anterior aspect, এটা টিপ হয়ে গেল, on the anterior aspect there is an oval facet for the attachment of the clavicle to form the acromioclavicular joint, which is a plain synovial joint, right? For the acromioclavicular joint, which is the plain synovial joint, অনেকগুলো লিগামেন্ট বললাম, So a very important viva which is asked in your exam, if the student is doing good, right, then the teacher will ask you about the joints formed around the scapula. তখন কি বলবি? First one, so there are two joints which are formed around the scapula. কি? Number one, glenohumeral joint or the shoulder joint, which is a ball and socket type of synovial joint. And another one is acromioclavicular joint, right, which is a plain synovial joint. ঠিক আছে? acromioclavicular joint কোথায় হচ্ছে? articular facet, oval facet here, there is present anterior aspect of the medial lip, and with the clavicle. Okay, it is getting attached with the clavicle. While glenohumeral joint is getting attached on the glenoid cavity, okay, by the head of the humerus. Two joints are formed. Now how many ligaments are there? অনেকগুলো ligaments আছে না? So coming one by one, first of all glenohumeral joint, ঠিক আছে? আমরা কথা বলবো about glenoid labrum, right? আচ্ছা, another one, okay, একটা জিনিস আমি মিস করে on the coracoid process, okay, on the coracoid process, নামটাই ভুলে যাচ্ছিলাম। On the coracoid process there are tubercles, conoid tubercle and trapezoid ridge, ঠিক আছে? There's a tubercle, conoid tubercle and trapezoid tubercle. Here get attached your conoid and trapezoid parts of the coracoclavicular ligament, okay? Here get attached the coracoclavicular ligament. So glenoid cavity the glenoid labrum হচ্ছে, capsular ligament হচ্ছে, ঠিক আছে? Now what did I say? There is a coracoacromial ligament, okay, coracoacromial ligament, সেটাই হচ্ছে coracoacromial ligament, right? তারপর at the base of the coracoid process is your transverse scapular ligament. না বললেও হবে, it's not much important because it is outside this region. ওরা বলবে তোকে এখানে কি আছে, ঠিক আছে? তাও আমি বলে দিচ্ছি, it will be transverse scapular ligament, right? and আরেকটা আমি কি বললাম, coracoacromial ligament, okay, coracoacromial coracoclavicular ligament, ঠিক আছে? coracoclavicular ligamentটা কোথায় অ্যাটাচ হচ্ছে? on the tubercles present in the coracoid process, ঠিক আছে? the conoid and the trapezoid parts of the coracoclavicular ligament. So understood all these parts? Scapula ধরে usually, right? So scapula টা ভালো করে পড়ে যাস. I hope it has been I have made it bit easy for you. It was easier for you all to understand it rather than going through the book. I will come next with the humerus, okay? बस चलो टाटा बाय बाय।